And that's you now live. Thank you.
Good afternoon, members, and welcome to this meeting of the RRR Subcommittee. This meeting is being live streamed and recorded, and the recording will be made available on the Council website for public listening. Could I remind members to follow the good practice guidance, which includes muting microphones and switching off your video if you're joined remotely when you're not addressing the meeting. Should you wish, again this is for remote members, should you wish to contribute to any item, you should write speak in the Teams chat function and you'll be invited to speak in order. And we will also include on the list of who wants to speak the people who are in the hall and have indicated that they wish to speak. Should your question or issue have been raised by a previous speaker, please withdraw your request so that we deal with the business as efficiently as possible. Please ensure that for complete transparency there is no material posted in the chat function, which is in fact a contribution to the debate and should be shared in the discussion. The usual standing orders apply, including that any votes will be undertaken by roll call, though we should bear in mind that we are not a decision-making committee. If any member has to leave the meeting for any reason, again, any remote member, can I remind them to either leave the Teams meeting for that period of time or leave in the Teams chat function and then join when they rejoin the meeting. This will allow us to record member presence and ensure that the meeting is quiet at all times. I should be grateful if contributions are focused on areas where clarification is required by a member or to propose or support an alternative to a recommendation in a report. Nick, can you provide the sederant and any apologies, please?
Thank you, Leader. Yes. Currently, all members are present either in the room or on Teams. The only member not currently present, unless he's just popped in, is Councillor Carruthers.
Thanks, Nick, and I confirm my agreement to the participation of those members recorded as participating remotely. Do any members have a declaration of interest they wish to make? So not seeing any hands either on the screen or in the room. So if we move on to agenda item 3, the COVID-19 response, renewal and recovery, report by the Chief Officer for response, renewal and recovery. This report provides details of a recent position in terms of the response to the COVID-19 pandemic and the Council's contribution. The written report is a bit out of date, as I'm sure members have noticed, especially with regard to rates of infection in Dumfries and Galloway. The current situation was that there were 555 new cases in the 7 days up to yesterday and 127 new cases in yesterday alone. So obviously a very serious situation now. Our current rates of infection and 7-day positivity rate would just about have placed us in level 4 of the previous old levels system. Richard is here present, and I think is Mark here remotely, and they are available to assist members with any questions. But I'm going to ask Richard first of all if he's got anything he wants to add to the report.
Thank you, Leader. Good afternoon, members. As Leader has said, the current position has obviously changed quite significantly since the report was written. And we've seen a significant increase in the number of infection rates across the region, and that position continues to follow that trajectory, I'm afraid, as per information and data we've received as early as this morning. We've been liaising with public health colleagues based on the data we're receiving, and we've been keen to obviously engage in that detailed discussion with colleagues to try and understand the reasons for those increases and to work with colleagues in order to put in place the action that's required through a multi-agency approach moving forward. So we've got Mark Thompson on the call. Mark's just come out of actually a meeting with public health colleagues this morning, and with your blessing, Leader, I'll ask Mark to update us further in just 1 second. The second part of the report is in relation to the Council's action aligned with the move to level 0 and beyond, and a return to the workplace. Members, as we've previously reported to this committee, we continue to take a phased and managed approach and a continued commitment to the hybrid model and ethos of working from home if it remains possible. At 2.3, we've requested members' acknowledgement and support in terms of the requirement for a continued enhanced cleaning regime that will allow us to meet Scottish Government guidelines in relation to infection control of COVID-19. And the most recent work undertaken in this regard would suggest a figure of up to 250k for the remaining financial year, and that will be a request through FPT committee next week in relation to the sustained current position and the facilitated gradual return of office, depots, ARCs, buses and any other community facilities that need that enhanced cleaning regime to ensure those compliance. Appendix 1 of the document provides some narrative which is very much a work in progress, members, in regard to living with change and opportunities to develop different ways of working, which will support transformation and the financial planning for members' future consideration. And I'm pleased we've got senior leadership team colleagues on the call as well today who will be available to discuss with members any thoughts specific to their area of service responsibility. But with your support and blessing, Leader, maybe ask Mark to give us a bit of an update from his conversations with Public Health this morning.
Thanks, yes, Mark.
Thank you, Leader. Thank you, Richard. So it is obviously a concerning position. Last week, over 400 cases, and the projections certainly for this current week that we're in, the NHS projections are that the numbers will be far in excess of that this week come the end of the week as well. So some discussions this morning with regards to the situation we're actually facing in Dumfries and Galloway, and I just wanted to relay some of the key points articulated by colleagues in public health in that regard. So first off, Dumfries and Galloway didn't really see the same peak in cases that the rest of Scotland saw in July. We had a rather strange situation where we had a rapid initial increase and then a plateauing of cases. But now we are seeing a further rapid increase in cases. But public health colleagues have not really been able to identify the causation for this as well, but we're obviously looking very, very closely at that. In terms of the high number of cases, it is quite clear from the statistics that public health have been looking at that rates of new cases is highest in younger age groups. And in terms of we don't have local figures, but in terms of the kind of national picture with regards to vaccination and how that relates to case infection rates, the highest rates absolutely still remain in the unvaccinated, are slightly lower for those who have received their first dose, and are significantly lower for those who have received 2 doses. However, it does not negate the potential for infection with COVID after having received 2 doses. And on that point, they wanted to make clear that the vaccination is very effective at protecting against the kind of most significant health outcomes from COVID, and 2 doses provide the greatest protection in that regard. However, with the Delta variant, which is a highly transmissible infection and highly transmissible variant of COVID, it is not quite as effective at reducing transmission of the virus. So whilst we certainly see the real tangible benefits in terms of reduced numbers of hospitalisations, reduced mortality associated with COVID, we still see transmission, and that is certainly a factor in what we're seeing at this moment in time. And obviously key messages from public health that they continue to articulate, and we as a council will continue to articulate, is to reduce the risk of catching COVID-19 and to minimise disruption, following those key messages that Scottish Government are putting forward in terms of get the vaccination when you are offered it, wear a face covering where required, wash your hands regularly, cover your nose and mouth if coughing and sneezing, self-isolate and take a PCR test if you have symptoms, and take regular tests if you don't have symptoms in order to reduce the risk of spreading, and other simple measures such as meeting outside if you can, open windows when indoors, keep your distance from people not in your group, and work from home or a mixture of home and office working where possible as well. So happy to take any questions or observations from elected members.
Just while we're on that subject, Mark, on the 7-day figures from yesterday, 45% of them were in Dumfries town, which is rather more, but twice what we'd expect in terms of the population. I just wondered if the public health had any indication whether that was hospitality, whether it was workplace transmission or whatever.
The indications are, and you're absolutely correct, Leader, that DG1 and DG2 postcodes have seen the most statistically significant increase in cases. Welsh cases are right across the board in every single postcode area. There is a particular focus in DG1 and DG2. There is no clear clusters or associations with activity, and it seems to be that this is just widespread community transmission. So you will see a blend of hospitality, you will see a blend of household transmission, and through wider friendship groups as well. But nothing that they can actually say, here's a particular cluster that we can actually take some mitigation against.
Thanks. I've got Councillor Wilson, Councillor Hislop and Councillor Scobie. Councillor Wilson.
Thanks, Leader. I have a question on the back of sort of what Mark has said just there, and it ties in nicely with your question, but I do also have some points on the report, so I don't know if you want me to just sort of ask Mark first and later.
Yeah, ask Mark first and then give your points.
Excellent, thank you. So, Mark, clearly you've just said it looks like it's a widespread community transmission. So I'm just wondering, is there a sort of plan being put in place maybe to really ramp up the sort of asymptomatic testing message and communication? If there is, if it's not a sort of identifiable cluster, it seemed to make sense there to really encourage that message of taking up the asymptomatic testing offer.
No, absolutely, Councillor Wilson, and it's a very good point. We have been at pains, and we've taken a lot of measures to really push the message in terms of significant radio advertising, flyers being distributed to all households in the region as well, and we will continue to do so. And I think Annie might be able to touch upon that, the testing specifically, but we have seen an uptake in the past 2 weeks, a 20% uptake in asymptomatic testing 2 weeks ago, and a further 25% uptake in testing last week. And we expect that trend to continue. So it's important that we make sure that we've got the appropriate resources available for this testing for people to be able to access this testing, because I've got no doubt as cases increase, levels of anxiety will increase and demand for testing will increase, which is to be welcomed to actually help manage and mitigate the spread.
Thanks, Mark. Do you want to make your points about the report?
Yes, thanks. So just looking at the report, a couple of observations I would make. First of all, in the recommendation 2.3, I think it would be quite advantageous just to sort of change the wording to make it clear there is a request for funding. I completely understand the need for those additional cleaning measures, and have no problem supporting that. But I just think it would be probably quite good to make it crystal clear that that is a request to FPT committee in the recommendations. And I just wanted to make a couple of comments on the appendix. I appreciate that Richard said that this was sort of a work in progress. But I think sort of just, I personally feel there's probably a lot of things missing here. I don't know if it's maybe, particularly in sort of the third question, any new practice or service development that require committee approval is maybe limiting it. But I just feel like there's a lot of things that have changed across council services, not just in terms of that COVID response, but actually just to make sure that our communities are supported right across the board. And while there might not be something that needs committee approval, I think there are things for us to consider. Just a couple of things that I was thinking about as the events champion. Our officer resource is much more, or has been sort of much more aligned to supporting community groups in planning and hosting their events. And also there's been a significant shift to lobbying on behalf of events. Sort of a lot of the work that I've done as events champion over the last year has been trying to make sure that the questions that particularly our major events have are fed through to Scottish Government in the best way possible. And I just feel that, that isn't really referenced here, but similarly in economic development, we've worked with businesses in a in a much more intensive way. We saw that last summer. We've seen it again as we reopen the region. And I just feel that there's a lot of work that's happened there, and it's not necessarily about something that needs to be approved by committee, but there is something that we have worked with businesses in a completely different way as to what we have done in the past. And I think we need to consider whether that is the way in which we, that it's maybe we change the way we do approach businesses such as, stakeholders such as businesses, or maybe it's about working with the Community Planning Partnership and the South Scotland Enterprise Agency to try and learn from that methodology. And I think as well, I'd be quite keen to see some of the data that we didn't have previously, but we do now. We'll have a lot of data from actually how many businesses exist in the region because they were applying for grants and whatnot. We'll also have sort of the data on things like who is using household waste recycling centres and how can we better that offer to meet the needs of constituents. And I would be quite keen to see these appendices, much further developed to not even just on those sort of big ticket things that would need committee approval, but to actually look at how can some of the more, I don't want to say positive lessons, but some of those things that have worked really well over COVID, and particularly working with communities and working with local stakeholders such as businesses, can be borne out in the future. Thanks,
Richard.
Yeah, thanks, Leader. Thanks, Councillor Wilson. I certainly take your point in terms of the framing of the question. I'll take that on board. Happy to confirm that there's certainly an SLT and CMT commitment to embed new practice and service development opportunities in terms of the things we've learned through a COVID lens into the forthcoming transformation and budget setting process. I know that in terms of the work that's ongoing within services and directorates specifically, that is very much the case, and that will be reported through those services. But I'm happy to take on board those points. I think they're very valid. I think there are a number of things that don't feature in this appendix that can in fact really inform and shape how we can do things more efficiently, economically and effectively moving forward. So I'll certainly take that forward. Thank you.
Thanks. Councillor Hislop.
Thank you, Leader. A couple of points. See, with regard to hospitalisation, Mark, are we actually looking at a significant reduction because of the vaccination? Therefore, it's not as big a fear for the NHS that we're going to be overwhelmed with the numbers. Within Dumfries and Galloway, the variant, is that mainly the Delta variant that's causing the big spread? I'd like to support Adam's sort of points on asymptomatic testing. And I think we do need to get a message out there that just because you've had the double jag, you're not safe. Because there was, speaking to people in the shop that we have, oh, I'm fine, I've had my double jag. And I've actually heard this from NHS staff who I would have thought should know better as well. So something just to reiterate that. And it's on the report at 3.1.5. And I think I saw this actually on was it the government site as well? It's the second bullet point about the adult close contacts are not required to self-isolate. And it says if they're 2 weeks beyond being double vaccinated with no symptoms and return a positive PCR test, should that not be a negative PCR test? And I think that's actually on a government website that says positive. And that might be having an effect whereby people are reading that and saying, oh, well, even if I'm positive, I could go out. So maybe that should be picked up. Thank you.
Thanks, Councillor Hislop. Certainly in that last point, we'll double check that, and absolutely, if that's an error, apologies for that. It would certainly be the case that if you do not return a positive test, rather than returning a positive test, going back to your first point with regards to the hospital, certainly colleagues, and I don't want to speak too much on behalf of NHS colleagues, but it is clear that there is a reduction in the number of hospitalisations as a result of the vaccination programme. I mean, as I've said before, it is the key aim, and that is being seen. However, that does not reduce the concerns that NHS currently have, because at the same time as we are actually seeing we are seeing increasing numbers, albeit at a lower level than we would have had unvaccinated. NHS are returning to a lot of normal business as well, so demand, particularly for emergency and unplanned care, has returned to previous levels as well. So the actual demands on the whole system are significant as well. So any increase in hospitalisations related to COVID add to that pressure across the whole system. In terms of the point with regards to the variant, you're absolutely correct that in the UK across the board, the Delta variant is by far the dominant strain that we're actually seeing now. That's not to say there might be others in circulation, but absolutely it's the dominant strain that we're seeing locally and across the country. In terms of the testing, yes, we absolutely push, and just in terms of this morning, we just as an exemplar, we've handed out in the space of an hour at Tesco's at the Peel Centre, we've handed out 1,596 LFD tests and 92 PCR tests. Which is a significant demand, so much so that we actually had to go and pick up additional stock to actually service that need. And we're also having to manage queues at Queensbury Square this morning as well. So I think that the campaign that we've just recently undertaken is very much getting across to the community, and we're starting to take up notice. And of course that will be further helped by the increase in case numbers that we're actually seeing. But your point with regards to the comms is really well made, and that's something that we'll take forward with NHS colleagues as well, that message, if there is a presumption that having both doses of the vaccine mean that you don't need to worry at all about taking sensible precautions, that's something we absolutely need to dispel, and we will take that forward. So thank you for that.
Thanks. I think also on that point, that the second bullet point that Ivor was raising, I think also that people are required to self-isolate until they have a negative PCR test, and that's maybe not totally clear there. It sounds almost as if you didn't need to self-isolate, but you have to self-isolate until you've got the result of that PCR test. Councillor Scobie.
Yeah, Chair, it's difficult to try and make any kind of comment against, we're at the highest levels in Dumfries and Galloway across the whole of Scotland. However, I think we do need a lot more information, and appreciate Mark coming forward and giving us some of that. And Ivor's asked the question in terms of hospitalisation. There's nothing in here in the report about hospitalisation and the effect that the increase is having on age groups, because before the vaccination and so forth, we would be expecting a lot more to end up in hospital. And are we facing in this bout or increase of cases what could be regarded as a serious dose of the flu, where people, who previously who were vulnerable, elderly and so forth, would have ended up in hospital, even though they've been vaccinated twice, are still contacting the virus, but not ending up in hospital. And I'm not making light of the situation, because we're all in fear of catching it, each and every individual, in terms of that. But I think we need information from NHS in terms of hospitalisation, numbers, age groups and so forth. And not only that, but I think we should be encouraging and promoting the younger age group. I think there's countries that are going as low as 3-year-old in terms of testing, but we're still lagging behind in terms of our youth, and we're now starting to get there. But, there's a period in getting your first one to second one and so forth and so on, and those that aren't vaccinated, and Mark started to touch on it, in terms of the numbers in the lower age group against whether they're vaccinated, not vaccinated. And again, it's how serious, and it's always serious, that's why I'm saying it's difficult. But we need to know this detail. And the people out there, not just councillors that need to know this, the people out there need to know this, because people are returning to their own former normality. They are going about, the shops are open, hospitality is fully open, and it's difficult not to engage in that along with the community. So there are issues in terms of the report from Mark, which I appreciate, and Richard. But it then goes back to some of the issues that Adam raised in terms of stations, vaccination stations, and I see here in the report in 3.5 we've got community testing, then 3.55 refers to 13 stations. Are these 13 stations located there permanently 24/7 so that people can go? Because I've heard of others being directed to Prestwick and Cumnock from Stranraer. So we need to know, you know, and I know it's advertised and everything else, to I think Stranraer was 3 days per week. But when you need it there and then, it's difficult at times to get to Cumnock or Prestwick or indeed anywhere else. So maybe we could get some explanation on that. I did pick on what Mark says, what the reasons are, and we really don't know just now. But I think we should start to address this if we're going to tackle the particular problem. So there's a lot of issues in here in the report and from the update verbally. As I say, my question is that on the stations, the testing stations, that if there are 13, then they're located in the places that are most effective and that they're there 24/7. Turning to what the other parts in the home working and so forth, and offices open, council offices open, libraries, we've got the leisure facilities opening, but we're still seeing a lot not open, and the public's seeing a lot not open. And I think we need to be getting to a point of moving towards that. If things are getting back to its own normality, with the shops opening, with people moving about, they are expecting council offices to be open. Now, I know what it says, and we're following the good practices and guidelines in terms of working from home, but we have offices that are not open, you know, in terms of planning, paying, and so forth and so on. We do need to start to address that in terms of when are we going to move. And I know Nick gave us a phone call the other day that it's something he wants to talk to each and all the groups on, the political groups. But I think we need a full report on just exactly where we're at in terms of the opening up, because we are in zero, and it was referenced at the beginning that the reflection would be a level 4 when we're at 0 rating. And that's what the people out there see it. And they're seeing offices still closed. I had a wee kid shouting across the street at me yesterday saying, I tried to get into the library, but even when I pushed the button I couldn't get in, because it's there by appointment. So it is. And there's all things going on in the library. And I'm not criticising the library, nor am I criticising the staff. We're following good practice. But the public need to know, as they see the rest of the community opening up, and we are still seeing council offices closed, we need a greater, much more information on where we are with homeworking, to offices, to services, restarting, reopening, and so forth and so on. So if we could maybe get the questions on the stations. And just finally, and I hear what Mark talk about PCR, and I've been following the lateral flow testing. How reliable is it? I mean, I do it about twice a week, and it's not about me, but it comes back clear. But how reliable is that against what the acronym for PCR is, in terms of, you know, I could be carrying it, or anybody could be carrying it, thinking that the lateral flow testing is coming back clear. So there's you know, could be some maybe explanation, or do we need somebody for the NHS to explain these things?
Thank you, Councillor. Oh, sorry.
I'll just, thanks, Leader. Just start and then maybe hand over to colleagues in a second, because I think Councillor Scobie makes some really interesting and very valid points. we've got a real sort of dichotomy at the moment. We had that discussion with health colleagues this week, and as much that on the one hand, as you say, we have very much relaxed restrictions, we're open for business, and then in the same breath this week we've got this significant increase in positive cases. And I think what I would say, Councillor Scobie, is that this has really just hit us this last week, and last week and this week, almost out of the blue, in terms of this very large spike. And these questions, the questions you've asked, are the questions we've been asking and working with our NHS colleagues on, and there are no real tangible answers at the moment in terms of, as Mark said, why and where and who and what exactly has created this challenge. Certainly in terms of hospitalisations, we will be able to work with colleagues to get that information. I know as of the beginning of the week, it's fluctuated between 9 and 10 people in hospital with COVID, but certainly nothing like the figures we were seeing before. But again, as I say, I'm quite happy to work with colleagues to try and get a little bit more of that information as this sort of progresses, as it's been hot off the press, so to speak. Certainly lateral flow tests are a good indicator. They're not as accurate as PCR, we know that, and that's why we've there's the need on occasion to have PCR rather than LFT in order to get that more detailed levels of accuracy. Maybe hand over to Annie in a second through you, Leader, if that's all right. Annie's been leading on the testing programme and can give you very much more detail on the approach we've taken, the increase in terms of numbers we've had through the testing programme across the region, how we've targeted those resources at hotspots. And Councillor Scobie will be aware we were in Agnew Park earlier this week and had a really positive showing there in terms of the number of people who are wanting to engage with us. Absolutely take your point about reopening of services, of buildings, and meeting service need. That's something that has been the subject of discussion at CMT. I know it's been the subject of discussion at management team meetings within their specific service areas of responsibility and be fed back through those service committees. And we will obviously be supporting staff wherever we can to make sure that that happens, obviously taking cognizance of the fact that it still remains the Scottish Government's position that home working should be the default position at the moment. But you're absolutely right. We need to make sure we're providing the services that the communities need out there in terms of that, the council services across the region. But with your blessing, Leader, perhaps Annie can give a wee bit more detail on the testing for Councillor Scobie and answer those questions. Annie?
Yeah, thanks, Richard. In terms of the 13 static sites that we have, back at the beginning when we implemented the testing sites, we did operate on a 7-day per week model. However, the demand simply wasn't there. So what we looked at were the most popular days in each site, and we've tried to tailor delivery of testing to that. Councillor Scobie, you're right, in Stranraer we are open 3 days a week. The Scottish Government testing strategy has changed and flexed as we've progressed through the pandemic, and we've got to be fairly reactive on the ground as a result of that. So where initially we offered access to a single test where members of the public would come in and undertake the test themselves, and our staff would read that and report the results. We've now augmented that with the option to collect packs of 7 LFD kits, and that seems to be a much more popular mechanism for accessing LFTs among the public. We have also now started to make available home PCR testing kits, which does give us a better reach across the region. So I think when we're talking about people being referred on to other areas to access testing, that's where they would go and undertake a PCR test, and the result would be read by Scottish Ambulance Service staff. And that is governed by where the mobile testing units can be stationed. So having that option to pick up a home PCR testing kit at our static sites means that you probably have to wait less time, and we've got a better geographic spread. people do have to undertake the test themselves and send it away. So there's still a small delay, but it is small. It's generally within 24 hours that they'll get the results of that. Because of the new changes that we've got and the fact that people are being asked to show a negative PCR test to allow them to avoid having to isolate, we anticipate that there's going to be an increase in demand in that, and we will be talking with colleagues in NHS to see how our sites and our testing staff can flex to support that across the region. So we are constantly evolving, and we're trying to make sure that we're able to meet the demands of the different communities that we operate in. We also do have 2 mobile testing units, and we're commissioning an additional 2 mobile testing units. I don't have timescales for them at the moment, but we're hopeful that that'll be fairly soon, and that gives us additional ability to go out even further into other communities that don't have static sites. We have, and Richard touched on it, we have been able to support various local businesses when there have been outbreaks in different areas. We have piloted this morning, as Mark picked up on, with Tesco's going to their site on the Peel Centre. It's the first day that we've tried this, and we wanted to go to one site first before we rolled that out. It has proved extremely popular, and I think that it's important that we make testing accessible to members of the public in as easy a way as possible for them, and perhaps supermarkets are going to be that really easy way. I can just pick up my pack of tests when I'm out doing the shopping. So as a result of that very positive pilot that we've done this morning, we will be making contact with all of the supermarkets across the region and trying to put something in place. We have risk assessments in place for our staff being able to do that now, and I'm hopeful that we gave out 1,500 lateral flow kits and just shy of 100 PCR home testing kits. What was my next point going to be on that? So as I say, we're having to be really flexible, and we're working as hard as we can to make sure that we're reactive to the situation, and that we're working with NHS to support them and to support Scottish Ambulance Service and their mobile testing units. In terms of communications, again, Mark picked up earlier on the increases that we've had over the last few weeks. We had different communications campaigns running week after week. So following the adverts in the local printed press, we saw a 20% increase in uptake. We saw a similar 20% increase following GovDelivery emails, which went to all of our staff, but also any members of the public who've signed up to that. And we saw a 45% increase in uptake following the mail drop that we did to every household in Dumfries and Galloway. So again, I think we need to learn from the impact that various different communications methods are having. And certainly that's proved very effective. I'm happy to take any further questions on any of that.
Councillor Scobie, you wanted back in?
Maybe not so much a question, and this is not a criticism of Annie or Mark or Richard. It's how we work together and whose responsibility is it. Can't be all the council's responsibility. There must be NHS responsibility in here as well, because I hear Annie talking about different things, a silicon FDC or something, whatever that means. I've not heard of that one, but then we've got asked the question on the lateral flow. And how reliable it was to Annie coming back and saying we've got PCR home kits and so forth. All these cases, and you've got most people have a mobile, and then something flashes up. You've been in contact, not even close contact. You've been in contact. You must go and isolate. But it's when they go looking for that testing station now. If the 13 static are not there permanently, as Annie confirmed in Stranraer, and I'm sure it's the same in other places, then people start looking, where do I go? So she's alluded to that we might get the supermarkets involved, which would be a good thing. But when a person, has come into close contact, they need that there, they start looking about. And what I'm saying is some are being directed as far away as 60 and more miles away for a test, which sometimes is just not practical. And we've got to be able to, not we, but the authorities that are responsible have got to be able to respond and react to that so that it's available. Now, some of the ways may be by Annie, what Annie alluded to, but we've got to get the message out there so that if it's available, people know where to go and not be sent, 60 miles away. That's the point I'm making. So the lateral flow, I accept, is not reliable. There's another kind I'd like to know about the silicone one, Annie, what that actually means, or this home kit of PCR. It's when there's contact and there's close contact, and they do flash up in your phone. And again, is it serious? And I don't want to underplay or undermine anything, but is it, now that we're facing this pandemic more to young people in the main, that's why we need the reasons, and is it a serious bout of the flu? And I know nobody will want to come out and make that statement because it's putting their head in the block, but we need some explanation, and people need explanation, because I know people who would fall into the serious group, the vulnerable group, who have contacted it, but they have not ended up in hospital. So we do need this information so that the community are fully aware, recognising the increase, because for every case that's increased, then there's contact that'll go, tenfold. So we do need the fullest information, either from the Council and or the NHS, or better both.
Annie?
Yeah, sorry, I'll just come back. Sorry, that's possibly me not being clear, Councillor Scobie. It was a 7-day pack, so you can have a lateral flow test in one of the static sites, which is a single test that you would do on site, or you can collect a pack of 7 lateral flow kits to take home and to undertake at home. And I think, just to clarify a little bit, the lateral flow tests are designed to be used by people who don't have symptoms of COVID. If a positive lateral flow test is returned, you would be asked to go and take a PCR test. The PCR tests are delivered at the moment by Scottish Ambulance Service using the mobile testing units, which are on a schedule around the region. And what we're able to do now at the testing centres is to have people collect PCR kits that they can undertake at home and post away, so that if they have symptoms, or if they've got no symptoms and they've returned a positive lateral flow, or if they're a contact and they have to have a negative PCR, they can collect them in any of our sites. Some of the discussions that we've been having with some of our partners, including the Scottish Fire and Rescue Service, are around pick-up points for PCR kits, so that there is a greater availability. And again, that's something that we will be discussing with NHS in the very short term to try and make sure that we do have that availability across the region.
Thanks, Annie. Councillor Ferguson.
Thanks very much, Leader. A couple of questions. The first one is actually from kind of personal experience. I went for a test up at Mountain Hall prior to day surgery a couple of weeks ago, and I got a text message back to tell me it was negative. And so it's the language is there, because what it means is I didn't have COVID. It's the other positive. And I'm actually just wondering whether Annie could take back to the NHS, so that, I suppose it needs clarification. I think that's what I'm getting at here, because what they're meaning here is the test is negative, right? Not that you're negative, i.e. you've got COVID or positive. If the test was positive, then you would have COVID, and it's just the wording. And I think maybe there's a bit of simplification in there in terms of the message to the general public, because I panicked, because I thought, shit, I've got COVID, do you know? And I didn't have. So that's just something Annie can take away and work with public health colleagues and maybe feedback up the tree. But my main substantive point was kind of started off by Adam away at the very start, and that was about the cleaning regimes and how we budget for it. And I think we need a change of language here, because it should enhanced cleaning gives you the impression it's only for a period of time. These new cleaning measures are probably going to be here forever. So we are going to have a serious look at the budget implications of making sure that the required levels in the different settings is met. And I think it's almost moving it to a statutory responsibility in terms of welfare of the staff and welfare of the public. And I think maybe we just need to beef that up a wee bit, that paragraph, that's 3.7.6, as we take this forward. I mean, I'd love to be proved wrong in here, but I can't see us going back to the old cleaning standards. I think we're going to have the current cleaning standards will become the norm, and enhanced will be an extra measure on what we're currently doing just now. And I see Richard nodding there, so I think he's understanding what I'm getting at here. And I think we need to get that point across, because it is going to be a serious budgetary concern come budget setting.
Thanks, Richard. Do you want to comment?
Thanks, Leader. Thanks, Councillor Ferguson. Yeah, I mean, I think certainly the work that the Solutions Centre has done to date to ensure that we are compliant in terms of the Scottish Government guidance as we sit here and now has been first class. Hence the request to meet the ongoing requirement as things stand. But you're absolutely right. If that's going to be a sustained position, then that's something certainly as an authority we'll need to consider in terms of the future budget provision in that regard.
I think your experience also illustrates something that, this morning there were 11 cases in hospital and 1 in ICU, but actually it's people who've tested positive, it's not people who are in hospital for COVID. So somebody like yourself, if you had tested positive, you might still have had your medical procedure, but you would have been marked off as one of the people who was positive, even though you weren't in there for that. Councillor Thompson.
Thanks. Leader. Okay, so I think one of the things about this report is just how it's structured. So there's an awful lot of ground covered in it, as we've experienced just from the nature and range of the questions. But just on the budget issue, firstly, I think, Richard, you mentioned it was up to 250k, which obviously that's new information after the papers were issued. And that would be, as paragraph 3.76 outlines, that's so we've got an agreed budget until March 22, but not for non-school buildings. So presumably, and this is maybe something we need to build into the recommendation so it's clear what we're actually asking for, we'd be looking to ask for up to 250k for the additional cleaning required for non-school buildings as we go forward, and that we don't really know yet what that looks like, but that would be the provision based on some information that we don't have in terms of what we might need. So I suppose it's really just seeking that clarity, because we'll obviously come to the recommendations and firm them up. So would I be on the right lines with that, just to nail that one down first?
Thanks, Leader. Yeah, through you. Absolutely, Councillor Thompson. That's the indicative work that's been done today by the Solutions Centre would suggest it's a figure of up to 250k in order to meet those additional cleaning requirements as a consequence of us bringing back on stream a number of buildings that have yet to be back in operation, so to speak, but to sustain the current position with the school estate as well.
Okay, and just on the school estate, I mean, I've got unfortunately a big list. This comes back to the way the report's structured, but just on that, because in the appendix it does talk about school lets. Now obviously that is a school cleaning regime which will be affected by how open those facilities are and how ad hoc or available cleaning staff are to provide the letting service. So I'm a wee bit, I suppose there's an element of caution there about should we be careful about what we advertise as available, because we're not going to be able to honour bookings in some cases, or we're going to have to say, well, you might be able to book the court, but it depends if the cleaner's there, which isn't really an ideal position to be in. However, that's already budgeted for, if you see what I mean. So I think there is a wee concern about that. The other thing just in the appendix, while I'm on the education side of things, is just on the it's on page 10, it's talking about the feedback from early learning, ELC and schools. I'm just wondering, does that include or exclude private and voluntary sector early learning nurseries, for example? So it's not articulate. I don't know if we're now at a position where we're maturely assuming that we embrace the full family of those who are providing early learning ELC, or if it's only the council services. So it would be good to get a response on that. I also noticed in the appendix, and I know it's a work in progress, but it's brought to light by some of the questions today. There's no response from the IJB lead officer in there, and I'm just it brings me back to a more general question about communication and leadership, which is about, I've heard today that there's mobile testing units that we are going to be offering. There's Scottish Ambulance scheduled mobile testing units across the region. We've got static testing sites which we may or may not be able to service, and it would be helpful to know how many of them there are, what the level of usage is, how much that's changed within one sheet in the report, for example, and then we could deal with testing. The vaccination side of things, I don't know what the uptake of those is. It would be helpful to know, because we need to know, are we targeting our resources with our partners as effectively as possible, whether it's a drop-in centre or not. And also just the messaging. I've had constituents ask me about drop-in centres where it wasn't advertised on the NHSD&G website, but it was subsequently made available to them, say, for example, sort of Morrison's or Lockerbie Town Hall, but that wasn't on the list that was published. So I'm really just trying to tease out who's leading on the communication. Is it Rod Edgar at NHS, or is it RRR team coordinating all that, or is it a bit of both, and then there's wee gaps in the middle, and we're just basically working with a lot of moving parts? So I appreciate guidance is changing, etc., but I'm just wondering, Councillor Scobie touched on it earlier about the 3 days a week in Stranraer. Is it possible even just to put a sign on the door if it's shut, saying we're open Monday, Wednesday, Friday. If you can't get here, there's testing kits available there. You don't have to travel 60 miles, and we're open on Wednesday anyway. You know, it's just something, it's a bit old-fashioned, I know, just having a sign on the door saying when you're open, but it might help, because otherwise we're going to end up communicating stuff that's out of date in 3 weeks' time, but people are maybe still thinking, that's the last information I've had, so that's why I'm turning up at the door suddenly to find it shut. You know, which people being people, that's what's going to happen. So, I mean, there's a few things in there, I guess, but one of the things I would say is maybe for the next report, if we had one on testing, one on vaccinations, one on thing, and then we could deal with it just more structured. I know we're into operational things, but I think it would help focus our questioning and the response time and maybe make it a wee bit more efficient. Just a suggestion. The only other thing is on 3.77, it talks about support for managers. Obviously, the wellbeing of staff is a priority at the moment. Are there normal methods for managers to report concerns, or if they need additional resources to deal with staff, or is that now being done through the RRR team? And the other thing is, in 3.78, it's talking about all proposals will be discussed with joint trade unions, which is good, about preferred way of working, and this approach should be encouraged, but it's not required. So I'm just sort of wondering, is there a wee bit of a grey area there where we need to strengthen what we're saying to unions so that they know that their input is not just encouraged, but they will be required to be included, for example. So a number of things there, like I say, but that's the way the report is, so that's again a scattergun of questions, if you like. Thank you.
Thanks, Leader. Councillor Thompson. I think in a general comment to start with, in as much that the established systems and processes that we have in place, be that supporting staff in terms of their own mental health and well-being through HR policies and indeed through working practice within departments, has continued and will continue. The same with joint trade unions. Engagement with joint trade unions within departments and directorates, I know, has continued and continues to do so. In addition to that, because of the issues and the additional challenges aligned with COVID, we have endeavoured to put in additional support to those type of processes. I meet with the Joint Trade Unions fortnightly specifically to talk about activities and functions through a COVID lens, and I do that in a very proactive way and feed that back to departments in terms of what might be required and how we might influence and shape what would be considered to be the norm. But I also keep them updated in terms of the figures and the stats and exactly the approach that we're taking across the piece. In terms of testing, I accept and I agree that it's a complex landscape. There are various methods to maximise access around testing. All of those methods that you spoke about are coordinated through, at the moment, Annie in terms of RRR, because this was external funding that we received from Scottish Government to NHS, but through the partnership we have in the Resilience Partnership, it was agreed that we would take a lead on that specific area, so the funding is utilised and we coordinate all of those things. I know it seems as though there's a lot in there, and indeed there is, but it is coordinated through us. Communications, the comms cell that was established through the NHS with Rod Edgar as the lead has been taking a lead on that, and if there are things that have fallen through the gaps, then more than happy to have a conversation and pick that up in terms of how we can strengthen that moving forward. Vaccination is slightly different. That is absolutely an NHS lead. All we are doing in terms of vaccinations is supporting NHS colleagues in terms of facilities and making sure that there's a range of facilities available to the NHS and indeed our communities in its widest sense to try and support that broad vaccination programme. In terms of school lets and the question around ELC and schools within the report, I'm not 100% whether what's included or not, but I'll go back and double check and let you know, Councillor Thompson, and indeed the other members. I do know though that up to now the school let process has been very much offered and reopened on a managed basis, and only when we can deliver those services safely, i.e. cleaning regimes, staffing requirements, etc., have those been considered, and it's been very much of a sort of phased approach on that basis as well. And I take your point in terms of the report. I'll try and make sure that that's clearer moving forward in the future.
Thank you. Councillor Wilson.
Thanks, Leader. It was a very quick point. I really appreciated what Annie had sort of outlined, and I appreciate that, sort of the rapid response that we have to take in terms of testing, and due to the nature of the pandemic, doesn't quite fit in with approving committee reports, etc. But it was just, I found it really interesting, really useful to know about some of that constant evolution of our testing programme, and particularly focusing on supermarkets, and for me there was something in about actually testing not being as easy and as convenient for people as possible, which will obviously help to encourage more people to take that up. And I was just looking at 3.5.4, and in the testing strategy principles, I'm not sure if these are from Scottish Government or Public Health or what we've developed internally, but it would appear to me that actually our principle of testing being convenient and as easily accessible as possible, at big employers, at supermarkets, in town centres, to me would seem like a good principle to have, and it maybe just needs borne out a little bit more in 3.5.4.
Anybody comment on that? Annie.
Thanks, Leader. Yes, those are Scottish Government principles, but I absolutely agree. We do attend national reference groups and have an opportunity to speak with Scottish Government and feedback any of these kind of suggestions. And I think nationally people are finding the same thing, and as we are piloting different mechanisms for reaching communities, we can certainly take that back. But I absolutely agree, and I'm happy to take that back to Scottish Government.
Thanks. Okay, I'm not seeing anybody else wanting to speak, so if we go to the recommendations, we're being asked first of all to note the current position with regards to government COVID policy cases and the ongoing response, So happy to note. Then we're being asked to note the ongoing need to coordinate partnership working with the NHS for vaccinations, testing and future outbreak management frameworks. Happy to note. We've some good points made during the discussion there on testing and so on. And then there's been a suggestion for a slight alteration to the third recommendation, which has come from Paul, I think. So it'll be 3.3, and I'll change it very slightly just to bring in something Adam's point that Adam made. 3.3, the update with regards to the return to office working and the intention for a request rather than a proposal. I think you feel there should be a request going to FPT, a request to be taken to our FPT to seek agreement for one-off costs of up to 250k regarding additional cleaning measures required to facilitate a gradual return to office working and the move to level 0 and beyond. Councillor Thompson.
I could happily defer. I think Councillor Scobie's hand was up first, to be fair. But that's okay.
Basically, Chair, and you did go through those in noting, but I think, paramount to each of the noting is that we do need a lot more information and current information, and I think Richard referred to it, that even this report would be outdated by the increase. And I know we do get different things, but it's the type of information that was requested on the number of questions that were asked by a number of members. And I think we do need to look for a great deal more comprehensive information, in terms of reasons and effect and so forth. So I would hope in each of the noting that we'd be looking for a lot more information. I'm sure Stephen can talk in 2.3.
I think Richard said that he would take that on board for the future reports. Stephen.
Yes, thanks, Leader. So just, happy with that form of words. I think just specifically, though, it was relating to non-school. I think we had agreement for budget up to March 2022, so just to be as clear as possible about that. Thanks. And just when you did mention about the NHS, I think in the last noting one, are we including implicitly the Scottish Ambulance Service? Because they are sort of the front line of the NHS, but would be sort of semi-autonomous in their own, well, they're seen as the sort of front line of health services. But so just to be, if we're being specific,
they are a separate organisation to the NHS, yes.
Yeah.
Okay.
Leader, I think there was also, we were trying to beef up about the long-term budget implications of the cleaning regimes, not just the immediate future, the next 18 months or so. We're talking about long-term, and I suppose we should, it's how we word it. I would suggest is maybe or just leave it to Richard as a thing, something to take forward so that future reports could include that.
Well, I think that's something we'll have to look at during the budget. Is actually that will have to be built into the budget for next year.
Well, absolutely. And budgets for years to come, I would suggest, Leader. Yeah.
There's quite a number of points that we made there that Richard will take on board. If we could go now to Councillor Wilson. No, he's already been in. He's already been in. Oh, he wants to come in. Well, did you want to come in again, Adam?
Yes. On the back of Councillor Ferguson's point, I agree with what he says, but I just think at this moment in time, the recommendation, I think there's a need to get a budget in place. And I think that, certainly I would hope that officers would take that on board either through, the budget setting process or identifying that future long-term need. Because I do agree with this point, but I do think that there's a sort of urgent and, sort of need now to get that budget in place in the first instance.
Okay, so if we could go on to agenda item 4, which is on refocusing recovery. This report provides an update in relation to Community Planning Partnership Recovery Planning and Activity. Outlines the proposed arrangements to deliver on the subsequent decision taken by full council in June 2021 regarding the conclusion of the council plan review and engagement to inform the council's renewal and recovery plan and council's budget for 2022-23. And I know there are some issues around some of the engagement process, which I'm sure that we'll tease out during the discussion. Richard, did you want to add anything or should?
Thanks, Leader. Just briefly, so again, this paper sort of covers two areas. The first one is just to provide members with an update of the work in progress in terms of our work with the community planning partners, and particularly the community planning executive group, which has revisited the initial community planning recovery document that was developed. But we've also now embarked on quite a chunky piece of work looking at the various recovery strategies and documents across the community planning estate, so to speak, looking at identifying where the gaps are, and as a consequence of finding where the gaps are, then producing a new document that will really be able to provide the community planning executive group and then the community planning board with a real focus on the areas that we can consider that are required a real multi-agency approach in terms of addressing the recovery elements through that partnership approach. So the paper that goes to the community planning board in September will look very different to the appendices to the document today. They'll be brought together into one document with a real focus on where the gaps are in terms of the identified need for a multi-agency approach to that recovery plan. Secondly, the paper presents, as the leader has said, the proposed engagement programme specifically for the Council's recovery agenda, and indeed what will then help support future transformation and budget savings programmes. And I know Kirsty is on the call and happy to take members' views and opinions in terms of the engagement programme as well, leader. So happy to take questions through you.
Thanks, Richard. Councillor Scobie.
Yeah, Chair, I welcome the report, and I would applaud the work of Richard and his team in terms of going back, as it states in here, in terms of engaging with the community. And it was something I was suggested some time ago, and it's under 3.2 under stakeholder engagement. But we moved on, and the report has also from the initial discussions. And we are still faced with issues within the community in terms of recovery. And recovery in terms, again, of staycation and the impact that has on communities. And while we entered into engagement with them, I'm not too sure that we have finalised, a total agreement or understanding with the communities. And I know I have had communication and emails in terms of, people ending up in different locations, being on holiday as they are and still are, were and still are. And they get up to, barbecues and everything, and they start raising fires and different things. Then they start looking for toilets. And just in the space of the time at the meeting today, I just looked at my emails, and there's one in there from Bulgate in Stranraer, where we've got bird watchers facilities, but yet no toilet facilities alongside it in that particular bunker. So we haven't got it right, and I think we should be engaging with our community partners in terms of what's needed. If we are to go along, and we've had meetings with our counterparts in Northern Ireland that sees this as a growth area in terms of staycation, people coming. But having said that, then we need to have the facilities there. And again, this brings into play what Andy was talking about in terms of cleaning and provision. And it highlights another, and it's almost like under previous district council days, Wigton had a number of bylaws in terms of overnight stay. And the notices are still there. But I don't believe the bylaw has been renewed, where the signs clearly say that there should be no overnight stay. And we haven't renewed that bylaw. But it ties into the whole staycation and who's responsible. I thought I was writing to the right department when I wrote to the legal department, and it just seems to bounce back to roads. But it doesn't address the issue in terms of what the sign says and how enforceable is that sign at law. In terms of, if the bylaw has not been renewed when all the authorities came together, it needs addressed, and it needs addressed quickly. But it was something that maybe has not been taken into consideration by the community partners. So there are a number of issues in there in terms of the communities engaging with us. Did they fully appreciate the impact staycation would have on the area, if there aren't the facilities available, toilet facilities, etc., and people on holiday do get up to, you know, different things in terms of barbecues and how they create that barbecue and the effect that has on the environment. A lot of issues missing, you know, as not a criticism of the report. We need to get on top of it. Particularly, in my opinion, the new is the signposts that are up and how effective those signposts are at low.
Thanks, Leader. Through you, I'll just maybe kick off and then maybe hand over to Kirsty, who has also been leading on sort of the visitor management programme and our approach to staycation. And I think, you know, I understand Councillor Scobie's comments. We have had some isolated or individual cases where we've had some challenges, and that's I think understandable given the number of people that visited our region. We endeavoured, as you know, Councillor Scobie, to really to look at the first time that the region was opened and to learn from that experience and to try and build a whole range of mechanisms in terms of consultation and indeed resources which members through were supported financially, and we did that through the visitor management programme. I think very successfully across the piece. In fact, we've been using an exemplar nationally in terms of our approach in that regard. Notwithstanding that, I do know, and we have spoken about individual cases where there have been challenges, and as I say, that's perhaps not surprising given the number of people that we had and we still have coming to the region, which indeed we want to encourage because of the economic impact and the benefit that brings to it. But we need to make sure that those individuals come into the region and do so with respect, and that's been the whole premise, I think, of the campaign that we put in place, and utilising those funds through signage, through additional control measures like toilets and cleaning, etc., etc. So I know Kirsty can speak with much greater knowledge than I in terms of the things that we've put in place, and maybe can pick up some of the specific issues that Councillor Scobie has raised. Leader.
Kirsty.
Thanks, Leader. In response to Councillor Scobie's, it's possibly easier to pick up some of the detail offline, but maybe just generally to cover for this particular committee. But yes, I am well aware, given the volume of visitors that we've had to our region, and particularly in wards 1 and 2, that there have been a minority of challenges, if you like. And in particular, we can tell from the over 200 community conversations that have been carried out that toilets, particularly for Wigtonshire, has been that, and signage has been of their main concern. Certainly in respect with toilets, we've had probably more positive feedback about the cleanliness and standard of our toilets than what we have had negative responses. But I am aware that we've tried to work very closely with community organisations to find sustainable ways in which we can have toilet facilities that are there for the long term. And that has proven easier where we've got community organisations who are willing and able and in a position to put in perhaps LSAN points, you know, that some have taken that opportunity up, and we've supported them financially either through area committee or indeed through some of the visitor management funds that have been set aside. So I'm happy to pick up any of the specifics offline. I know we've got some challenges and that your ward, Councillor Scobie, has been one of the most challenging in terms of volume. I would have to say at this point that our signage campaign has been picked up from as far away as Australia. We've had feedback, people writing to the contact centre to say how positive and welcoming the signage has been, how we've embraced overnight campers, motorhome drivers, etc. And we've certainly had community councils from Perth, Fife and over in the borders looking at how we've approached this. And I personally took a call from a landward journalist who wanted to pick up on some of the way in which we've been supporting or trying to redress the impacts of wild camping. So I know it's not all positive, but I think we have much to celebrate in terms of how we've gone about it. And certainly I would be concerned if we feel that the engagement with communities has not been sufficient, because that's something, as you'll know, we take very seriously and want to ensure has been a positive experience. for those involved. So happy to pick up any specifics if you like, Councillor Scobie, maybe offline.
Councillor Scobie, you wanted back in?
Yeah, please, and totally to endorse what Kirsty's saying in terms of the people who are out there cleaning the toilets that we have provided, and it does, as I say, I would applaud Richard and the team in the engagement that took place in June. It may be that we need to return to the communities, as Kirsty said, and see, is it sufficient? Do we need to have further dialogue with you in terms of the provision? Kirsty says Ward 1's a challenge. I think Ward 1 reflects just what the wonderful the peninsula is and how it will attract people to it. And yourself, I think, is a frequent visitor of the particular area. But we need to manage it. We need to be able to work with the communities, and it's that engagement, that along with our community partners in terms of, because we want to encourage people to come here, even against the COVID. We still want to see them boost the economy, but we need to work with the communities that are having the effect of it. And Kirsty, I'll pick it up on or offline or whatever, but we need to be able to manage these issues. I only need to give an example, Port Logan, where we've got two car parks, one at one end and one at the other. We've got the toilets at that end, but the people park on this end, and it's a fair distance to walk. We need to be able to manage it and work with the community there, and that's just an example, and I can pick that up with you, Kirsty. But we can't do enough consultation with the communities to take the communities with us and to put over what we're trying to do by way of our economy in the area to try and boost it. But the signs are important again in terms of what is bylaws and not bylaws that were renewed.
Thanks. Do you want to add anything, Kirsty? Or?
Just, sorry, I didn't come back on that point, and just to say that there is currently plans to consult on the road traffic order that is required to address the issues. I am aware that we have potentially mixed messaging in that we have old, outdated road traffic order that has signage saying no overnight parking. We have tried to work very closely with communities to negotiate with them where we have used almost a kind of tier approach of stay the day, not the night, which is meant to be a kind of friendly move along folks if you can, and also one that's slightly more robust that says, no overnight parking here, and here is where you can park. We realise that the road traffic order is something that we need to work through, and I'll be making sure that the feedback we've gathered from communities about that and any individual concerns that have been raised, there has been one that I'm aware of, and I have reassured that individual that their feedback will be included in the consultation process, the statutory consultation process for that road traffic order. I'm also very conscious that we as a council need to make sure that as we change and adjust that road traffic order, we need to be mindful of our ambitions for the economic and social renewal of communities, as well as the enforcement side. So I think that is I'm aware, and we'll certainly be feeding back from a visitor management perspective into that process.
Thanks, Kirsty. Councillor Wilson.
Thanks, Leader, and I'm quite pleased that sort of Kirsty's sort of reference. I think the very positive. I mean, I've received nothing but positive feedback on our community engagement on particularly reopening the region over the last couple of months, and that's one of the points I was actually going to make in this. I think sort of specifically on the recommendation 2.2, I wouldn't be comfortable agreeing the engagement programme and the mandate at this stage for a couple of reasons. First of all, I think as well it reflects to quite a lot. I think actual decision at full council would be safer, but I think as well actually this mandate kind of reflects the ambition that we had back in sort of September, October time last year, which was absolutely right at the time. But I just feel that that there has been a significant period of time, both chronologically and just with everything that's happened since then, that we're maybe going to need to scale back a little bit more. I think it's important over the next couple of months, while I'm certainly touch wood, we are not back into significant restrictions or lockdown. I am concerned that the flu season and the winter might actually put pressure on our resources as a council that would sort of put us back in a position that we found ourselves in sort of December, January, of halting that community engagement. Also as well, I think that, we obviously are in a position where we are running up closer to a council election. And I think that, we need to be quite clear in any engagement that we're doing. Obviously it's the prerogative of a new council to set a new council plan if that's what they wish to do. And obviously it's the prerogative of citizens to elect councillors to represent their views. So I think as well, particularly, I'm looking at the webinar and the dates for the webinar, the webcast, sorry, getting that feedback available for March 2022. It seems like a little bit of a waste to me, because if that's how long it takes, by March 2022, we're going to be very much into that council election, have set the budget, and I just feel that that probably isn't the best use of limited resources at this time. So I would certainly sort of, that would be my initial comments. I think that sort of the 2.1 on page 43, I think those are exactly the right questions to be asking. I can see very much how that feedback would be used across a whole range of council service, in the budget, in the transformation programme, in the RR action plan, and actually just that restart of our council, of the region, of our businesses, of communities, and actually how that would be useful for both this council and also for the next council that's elected next year. And one thing I would be quite keen to see a bit more reflected in this is the success of the community conversations quite recently. As I think I said earlier, I've had nothing but really positive feedback. And that tells me that there was something that worked really, really well in them. And obviously, given how well they have been, I think it's important we try and reflect and repeat that success again, because it clearly something worked very, very well to get such positive feedback.
Thanks, Adam. I can just say that I agree with Adam on some of these points. That I think the engagement questions are excellent. I think that's what the information we want to have. But the council plan is going to be superseded next year by the next administration's council plan. So I don't know whether there's now any point in consulting on the council plan. I think its days are numbered anyway, and probably what we need is maybe a report at some point on what was successful, what was fulfilled and what was not fulfilled. But by the time we're doing some of this, the political parties anyway will be constructing the manifestos, going to the electorate with their manifestos, and certainly I just feel that part of it is probably redundant now. And for officers to put in a lot of work on doing that, I think is probably not the best use of their time. And I'd be quite happy to get out of having to do a webcast, because I don't like being filmed anyway. That is a personal view. I've got Councillor Maitland.
Thanks, Elaine. I'm just responding immediately to what you as chairman are saying, and I'm not entirely surprised to hear you say what you are saying. Can I go back just very briefly and endorse everybody's remarks about this summer? I have to say I was absolutely dreading it. I could just see the place being, my inbox being filled with complaints from the Glen Kens and people in the ward complaining about wild camping. Well, it didn't happen. And I think because we planned and worked in partnership with the third sector to put in a bit of resource, a bit of ranger, not very much, actually. I think it was really very modest, but goodness, what an impression it had. And I think that was very effective. And so I would very much like to see that continue. 2 points on the appendices, Chairman. The issue about care experience young people. I think we've been a bit distracted by COVID, and I fully understand why that has been the case. But I do think that we should actively resume our role as corporate parents, and that probably involves the Champions Board and that sort of work beginning to take more to the fore. The other issue that I'm very happy to see is the health and social care sector needs a whole systems approach. I totally endorse that. and I would like to be absolutely sure that we will have a clear lead on that. You know, not us, but we will know who it is who is leading upon that in the future, so that we can monitor and plan. The idea that every school leaver by 2030 would be in the health and social care sector just fills me with dread for the region, and we must at all costs avoid that. But at the same stage, let's use our resources right across the piece, and I think that's very important. I totally support that proposal.
Thanks, Kirsty. So you're still on mute, I think.
Sorry, Leader, do you want me to respond to Councillor Wilson's point? Was it around the methodologies?
Sorry, any of the points? Richard says he can pick some of those up as well.
So just to pick up Councillor Maitland's point, and then maybe hand to Kirsty, who can pick up Councillor Wilson's point, if that's okay, Kirsty. So absolutely take on board your points, Councillor Maitland. I think absolutely critical, well made. We need to make sure that through working with colleagues across the piece, multi-agency wise, that we don't let anything fall through the gaps, and we take advantage of the opportunity that's presented us to us. Every discussion I've had thus far with colleagues, NHS and Health and Social Care setting, with Lillian and the team, and indeed with wider colleagues around the corporate parenting agenda, are fully committed to that cause. So I'll certainly take those points back and make sure that it's taken forward in that fashion. And if Kirsty would maybe pick up on Councillor Wilson's points through you, Leader.
Yes, please. Sorry, I passed by and not giving you the opportunity to respond to Councillor Wilson. So if you could respond to it now.
Thanks, Leader. Just thanks for the positive feedback regarding the visitor stuff. I'll be sure to pass that on to colleagues involved as well as partners, particularly those community partners that we've been working closely with. In relation to the specific mandate that's being considered as part of this report, then I appreciate that time has moved on since earlier conversations. As you can tell from the body of the report, there has been a number of decisions just since the original one was taken regarding member-led engagement, and I appreciate that methodologies can adapt and change, and the community conversations that is proposed certainly would have worked well in relation to visitor management. So if members were looking for a similar approach to what we've taken in that, and perhaps not focusing on the kind of webcast type methodology, then that can certainly be adopted, and we can adapt the mandate to reflect that.
Thanks. I should really bring Councillor Wilson back or ask him if he wants to come back. Adam.
Thank Kirsty for that answer, and I think also we can amend the recommendations to suit, but absolutely, we just about learning from time over and what's happened over the last couple of months, and we can amend the recommendations when that time comes.
And to be honest, I think, the questions, again, I think are excellent questions in 2.1. They could inform recovery and the budget. They don't necessarily need to be in the structure of this is about the budget or this is about recovery. Actually, that's about people's priorities, and they should be informing everything that we do. Councillor Ferguson. Oh, yeah. Jane, did you want back at all before I bring Andy in?
No, that's fine.
Okay. Councillor Ferguson.
Me? Okay, thanks, Leader. Just a couple of things. Just to reinforce some of the very positive messaging the Council put out about being open for business and the different social media pictures and snaps of different parts of the region and red squirrels and all the kind of things. People were coming, and that positive publicity was really, really well received on social media. It wasn't attacked at all. In fact, one of the things that I reposted and retweeted myself, I had the most hits on was the positive message we sent out when there had been a small event up in the Mennock Valley area, and it was left spotlessly clean. And the positive engagement I got over that was huge, and it was from all over the world. People are absolutely right. So I think we need to pass on some well done to the team who actually put that together. That's the first thing. Kirsty mentioned something else there as well about the traffic regulation orders, and it's kind of raising a question in my mind here as the chair of the committee that oversees TROs. And I think Derek is online. I think the question for me is, are all the TROs we have in place still appropriate? Clearly, for what Kirsty's saying, they're not. But I would see that as a longer-term piece of work in reviewing all these TROs, because if they're not appropriate any longer, they shouldn't be there. You know, we should rescind them. And I'm wondering, I can speak to Derek on Monday at our group meeting, our business meeting about that, because I think that maybe that's an ongoing piece of work that department, that team have to take on board. But I appreciate not straight away, because it will be quite an onerous task. But I think we really need and in the areas where Kirsty's identified where the TROs aren't immediately appropriate, we need to get that fixed straight away. So I'll leave that in Derek's hands, because he'll have heard what I'm saying here. Yep.
Certainly no point in having those. They can't be enforced and they run out. I mean, it's just giving people false pieces of information. Did you want to respond to that, Kirsty?
I don't know what to speak on behalf of the director, but I do know that the RTO is under consideration and we're going through a process which was pre-COVID. And so I will be sure to make any feedback we've received as a result of the visitor stuff, which we are making the connections across the department anyway. But we know that we need to align some of our thinking going forward on which car parks orders are applied to, and obviously we've got great community feedback on where there are real concerns and actually where there are very few concerns, and it's accepted locally as something that just happens.
Thanks.
I perhaps would just take the opportunity to mention that I forgot to say, or it's been in maybe a comms thing, but the post which has had most significant support has been the support that we're providing to people who wish to create spaces for motorhome stopovers. So we're supporting any organisation or landowner who can use the relaxed planning restrictions to create spaces for up to 3 motorhomes. And that, in the space of a day, got over 15,000 hits and click-throughs on a Facebook feed of the Small Business Gateway post. And there is a huge interest in that area, and we've already aligned, and colleagues in economic development are already focusing on that in preparation for next year to improve our offer.
That's interesting, because it's been quite successful in the Highlands as well, hasn't it? So it's good to know. I wasn't as aware that we were doing it as well, so I would have given a better answer to somebody who asked me about that. Councillor Thompson.
Thanks, Leader. Yeah, so I think just in terms of the consultation mandate, I would tend to agree with you in that you know, things have changed quite a lot, and also I suppose budget engagement firmly belongs with FPT and then full council. And while there's a benefit to exercising the sort of engagement sort of resources available to RRR at the moment, I think there's a wee bit of muddying in the waters in a sense, because you've got a little bit here about the community plan and partnership recovery plan. So it seems to be one of these things where actually, no, it's done. It says there in 3.18, there's no recommendation for additions or amendments. So I don't know if that's that's it set in stone now, just it needs to be published or whatever. So I'm just kind of thinking, are we kind of mixing two things together in terms of this is setting regional priorities amongst all the partners? And it may be worth hearing what the communities have to say about that, but I don't know if they have an opportunity to feed in or see the final draft. And then there's what the council's role within that partnership is, and that's maybe where we get more towards, okay, what can the council do? And then you're into the 3 consultation questions, or the questions that are set out, which would naturally more feed into the FPT committee to consider, I'm guessing, in terms of budget considerations. However, I don't. While I like holistic approaches, I'm not sure that mixing what the community plan and partnership's doing and what the council does specifically within that is the best. I'm not sure. So, and I'm not sure if it's stretching the delegations of the RRR committee on the frontis start getting into that area. But again, happy to take advice on that. But generally, I would support the points that have been made already about just keeping the budget process maybe more limited, I guess. Thank you.
Thanks.
Yeah, thanks, Leader. I take your point, Councillor Thompson. I think certainly the information presented to members today is to demonstrate, I hope, that and to allow members to have some confidence that there is appropriate discussion and dialogue across community planning partners, looking at the way we have delivered services and through the pandemic, and more importantly, how they will need to be delivered through a recovery agenda, and the importance of doing that together, and it can't be done in isolation, and that really is just wanted to present to you today, that is a piece of work that's ongoing, and that's a piece of work that will be taken forward to the Community Planning Board in September. You're quite right in terms of delegations and FPT and the engagement exercise. Absolutely, that's where that sits, not with R. But again, just ensure that we build in that sort of COVID lens through that whole process in terms of moving that forward.
Okay, I don't see anybody else wanting to speak. So, first recommendation was noting the recovery planning arrangements as set out by the Community Planning Executive Group, which will be discussed by the next board. And then, I don't think we are going to agree the engagement programme as it is at the current time, because obviously we've had some discussion around that. So, we should maybe basically, because we've managed to just note, and this is suggested to me, note and comment on the engagement mandate as set out in Appendix 3, and then presumably you'd have to bring the final mandate to full council, or would it be elsewhere within the council that could go? Kirsty.
Just to reassure members, and perhaps to reassure Councillor Thompson, is that the FPT committee will consider an updated mandate with the RRR comments clearly on the COVID recovery side of things. I'll make sure that comments from this committee are included in that updated mandate going to FPT committee for consideration, given their interest in the budget development part of that. So if what members are saying is that they agree with the general ethos of the engagement mandate, however, a slight adjustment to the methodologies to scale back, then I would be able to pick those comments up to feed into the FPT report that's going to be considered at the end of the month.
Because I would imagine that FPT will want to get on with the consultation for the budget. I mean, the time is running short, so I wouldn't want to delay their ability to get on with that.
Certainly, Leader, within the agreed position currently, then the budget development timetable requires us to have reported to FPT by the 30th of September. So it would be helpful to us to be able to go to FPT committee this month so that we can get out and get on with the engagement in the lighter weather when it may be more accessible to more people.
Yeah, thanks. I see Derek wants in. Derek.
Thank you, Leader. Just hopefully to be helpful, I think the sentiments of the recommendation are that you have indeed considered the engagement programme. You've provided very helpful comments. These will now be provided to the FPT committee for their consideration at their meeting later this month in order to enable them to proceed with that engagement programme. So I think the decision will reflect the sentiment what I've described there, which is believed to be consistent with members' aspirations and direction of travel this afternoon. Thanks, Leader.
Thanks. Are members content with that alternative, that our comments are included in the report to FPT and in the mandate which they need to get in place by the end of September?
Yeah.
Okay, great. Thanks. So we next have the Education Restart Update, a report providing and updating since the last Education Learning Committee on 22nd of June on the arrangements for the return of all pupils to schools for the session 2021. And Gillian's here to assist us with any questions. Gillian, do you want to add anything?
Thank you, Leader. Really, it's been a smooth start. So we had over 21,000 children started in schools and nursery today, and our teachers and support staff were back in our schools yesterday. So we're well prepared There's a little, obviously, when the report was prepared, we have subsequently received further guidance, but I'm happy to take questions from members and I can update members on the reviewed and refreshed guidance that we have, if that's helpful.
Thanks, Gillian. Can I invite questions or comments from members, please? Everybody's very quiet. They must be pleased to hear that everything's gone smoothly. Councillor Scobie.
Yeah, I'm pleased to see that we have returned and we've returned on the basis that we have done, and it was good to see the pupils, the young kids today when I was in the school. I'm disappointed that I had to have a meeting today at Stranraer Academy, and I'll not bring it here. I'm just making a comment on it was a constructive meeting, and I hope we can get an outcome, a positive outcome, to resolve the difficulty there in terms of our additional support for learners. And again, that's all about returning with the correct number of staff and resources to deal with the needs of the kids. So hopefully, Gillian, that we will get a resolution to that in due course.
Thanks. Gillian?
I haven't had opportunity to speak to the Head of Education who was at your meeting this morning, Councillor Scobie, but I think suffice to say that the meeting was held with you and the head teacher on the first day of the new term gives an indication of the importance that we've placed on this matter. Thank you.
Thanks. Councillor Thompson.
Thanks, Leader. Yeah, I suppose when I saw this, I thought, oh, shouldn't this be an Education Committee? But it's been cancelled because there's no business, which in the start of school seems odd. But I suppose along with that as well, I mean, this does seem to be almost like an operational update. It's like, yeah, we've started and here's all the stuff we've put in place, which is good, it's positive. And also, I suppose we've just had the recent news that we've got a number of probationers joining the staff team. I don't know if Gillian wants to touch on that, because obviously that helps us deliver, and it also helps bring on and give teachers valuable experience which they can then take, or even maybe stay in the region, who knows. But hopefully they'll have settled in well, because they'll have been taking part hopefully in the inset days. And I don't know if Gillian's able to add anything about that.
Yes, I'm happy to. Through you, Chair. Yes, the Education and Learning Committee for August was actually brought forward prior to the summer holidays. So I hope that any specific business we should have covered prior to the summer holiday in the additional meeting that we held in June. And we've certainly got a busy agenda planned for October. So we had six probationer teachers. They joined us on Monday and Tuesday for their induction sessions, and then again on Wednesday for their formal school in service, and an opportunity to meet with their pupils and their colleagues. And I'm sure they'll be excited to join and to see their children. So yeah, warm welcome to our probationer teachers, and as always, we have our high expectations of the probationer teachers, and that they have high expectations of us in supporting them in their successful meeting their standard for full registration and full qualification. They're a really important part of our workforce, and as always, we keep a close eye on them. Look forward to hearing of their success as we go through the year.
Thanks. Councillor Hislop.
Possibly just a quick one, Gillian. Was there any issues with regard to the significant number of cases now with staffing being unavailable to actually cover the classes, or do you see that as a possible problem in the next couple of weeks?
Thank you, Councillor Hislop. I think it is one we must keep a close eye on. It is certainly a challenge. I think we have to be realistic that with numbers of cases increasing, and those cases increasing in the younger cohorts, as we know and we could expect, that we do have changes to the guidance that we have from Scottish Government regarding close contacts and the requirements for self-isolation. So that should allow continuity of learning and teaching for children in cohort groups, but it doesn't remove the requirement to self-isolate for those close contacts who may indeed be staff. And it's not just teaching staff, it's support staff and indeed facility staff. I met with Alan Mawson this morning, and we know that, as Richard has also highlighted, our cleaning programmes have gone very well. They're very important. but we must make sure that we have sufficient staff to cover these mobile cleaning units and the cleaning regimes in schools. All of our teachers will be working, whether they're self-isolating or not. We have remote learning in place for all our pupils, but I think I do have to, well, we have commitments for additional teaching staff, we have our probationer staff, and we will use our resources as cleverly as we can to maintain continuity of learning and teaching. But yes, I think it's certainly something we will need to support our head teachers in managing these class commitments.
Thanks, Julian. Of course, we've also had notification of additional full permanent staff as well to assist with recovery. Do we have any information as to when these teachers will arrive?
Yeah, well, yes, indeed. Hopefully they're with us at the moment. But yes, we do. We did have. We have plans in place for the additional the 100-day commitment that we have for the additional teaching staff. Part of the issue was that funding was for 1 year, and that would prevent us from offering permanent contracts, whereas we now have notification that funding is committed for a further period. So it's very useful and welcome, and we will be progressing the recruitment to those posts immediately.
Thanks, that's good to know. Any further questions or comments? I'm not seeing anything. Well, thanks very much, Gillian.
Thank you.
And that brings us to the end of, we know we've got recommendation. We're being asked to endorse the arrangements for the return of staff to schools. I was slightly questioning the use of the word endorse, but I'm informed that it's all right. I thought we should just be noting it, but I suppose endorse doesn't really make a lot of difference. But, so we're happy to do that. Yeah. Okay, thanks. And there's no further business deemed urgent due to the need for a decision. And that concludes our business for today. So thanks to all for attendance and contributions. Thank you.